Hello, and welcome to the CHCP Fall Town Hall meeting. My name is Elodie Dorso, and I have the honor and privilege of being your CEO. I'm here joined today by Nichelle Threadgill, our Chief Medical Officer.
Hello to everyone.
And Kim Shutnick, our Chief Experience Officer.
Hello.
What an incredible year we've had so far. Healthcare is certainly getting a lot of attention, both at the federal and the state level. But I'm proud to say that we're remaining focused on what we do best, and that's providing primary quality care to those most in need in our community. I'm excited about the future of our organization, but so proud of all the accomplishments that we've had this last year as well. Over the next 20 minutes, we hope to provide you with a glimpse of the great accomplishments that we've already done this year, and it's only November. What's on the horizon, and our growth that we expect over the next year or two. So hold on tight, here comes a lot of information. We're nearing the end of the year and the holidays are right around the corner. Yes, it's November and it's starting to feel like that a little bit. We had a chill in the air this week and I actually saw some of our employees wearing jackets. So woohoo, this is when we love to live in Florida. So far year to date, we've seen over 53,000 patients, which is an increase of 4% more than we saw last year. But more than that, we saw those patients 11% times more than we did last year. And why do we do that? We do that to help close those care gaps. We've surpassed our quality for last year as well. And Dr. Threadgill is going to talk to us about that in a little while. We've done a lot of opening of facilities this year and new things and welcoming new facilities on. We opened Oldsmar in April. Shane Gake leads us out there, and we were able to expand access to underserved populations that we weren't currently seeing. The Oldsmar location is also participating in a new Sunshine Health pilot, allowing access for patients directly to schedule through that managed care organization. We're excited to see what that does for us out in that area. We've welcomed our first mobile health center in June. And to date, the mobile health center has been touring the county, and the dental team has really adopted that mobile health center.
Absolutely.
They've participated in 9 outreach activities, providing access to 5 new sites, as well as seeing over 270 patients on the mobile health center. It's really been quite impressive this year to date. We're doing some great things in the mental health arena as well, right, Dr. Threadgill? I know that we've started a new initiative with the Juvenile Welfare Board.
Absolutely, and it's a phenomenal program. It's an absolute wonderful partnership. We're partnering with the Juvenile Welfare Board, working with the Children's Mental Health Initiative.
That's a mouthful.
It is, and so we call it our CMHI. Through this initiative, though, we're really able to bring behavioral health and primary care together, and we merge it as a relationship. It's something that we're great at because we integrate our care in many areas, but this is one that the community needs desperately, and really looking at how are we managing our children who possibly have behavioral health issues. And so it is screening, it's early intervention, and early access to treatment for those who are in need. Through this partnership, we're actually bringing aboard 5 behavioral health therapists who will be located at our 5 primary offices: JRC, Pinellas Park, Clearwater, Tarpon, and Lealman. And in addition to that, we'll also bring other partners which will really help with coordination of care, navigating our kids through the systems of behavioral health, and really helping with that integration. The project is led by 2 of our dynamic pediatricians, Dr. Robert Kickish and Dr. Norma Lopez Molina. And so we are super excited for this collaboration.
Wonderful. And I know they're doing case rounds with the physicians and with the CMHI team.
Absolutely. So weekly we have case rounds where the pediatricians are able to present cases. With these presentations, we're actually able to talk with our community partners and really look for solutions to issues that we may face in the office using our community resources. And so it's been amazing.
Wonderful. We're also doing some other training opportunities with Nova University. I wanted to thank all of our physicians who have welcomed the 162 students into our already crowded spaces to help provide education to the future leaders of healthcare. And so how are we doing with that?
It's been really great. I can't speak enough about the program. They all started in August. And we all feel it. And so we have medical students who are currently first-year medical students who are rotating throughout all of our centers, all of our specialties in pediatrics, family medicine, and OBGYN. shadowing and really experiencing what it's like to work in a primary care setting, what it is that you do as a doctor, because they don't know. They're starting as first-year med students.
Right.
And really, how do you approach patients and why primary care is so important? And so through that partnership, in addition to the students, we also will gain some faculty members who will also integrate into our faculty. And so we'll have also some physicians from Nova who'll be working with us and seeing patients. So another amazing collaboration that we have.
Wonderful. Another educational institution partnership that we have is with St. Petersburg College. I'm super excited about this. This has been about a year in the making. We will be having the first State of Florida Community Health Worker Apprenticeship Program in connection with St. Petersburg College. We will be hiring medical assistants and also allowing our own staff to apply for the apprenticeship to provide for really more in-depth training in the healthcare arena.
Absolutely.
Tell me about how that's going to help our physicians.
Oh my goodness. And so a couple of aspects that you mentioned. So we will start the program with medical assistants who will be joining in, completing their medical assistant certification and learning primary care, which is something that a lot of medical assistants don't get in the current education system, is how to handle patients, how to manage patients in a primary care setting. Right. So we will have the opportunity to train them so that they're already ready to care for our patients at CHCP. In addition, we're looking at career advancement opportunities for our current medical assistants, where they'll be able to also join in the program as we move towards developing community health workers, yes, and health coaches, which are really those who are specialized in particular entities or disease states or conditions. And so
diabetes,
now, absolutely,
hypertension,
prenatal
care,
OBGYN, exactly. And so they will really have that escalated expertise to really power our quality initiatives forward.
I'm super excited because I think that with the transformation of healthcare, it's requiring different roles and skill sets for our medical assistants. And so partnering with St. Petersburg College has allowed us to provide that specialized training and really upward mobility, career advancement, both within our facilities and the community, and really provide for more economic mobility as well.
Absolutely. Yeah. So satisfaction for those that are working, but also increased competency.
That's right.
And so that will help with clinical workflow, that it helps us to meet our missions of getting things done and getting our patients seen. So I'm very excited.
Great. I know that we as an organization have committed to at least 20 community health worker apprentices annually, and we're going to go from there. And so that's coming, and we're welcoming our first group at the end of November, I believe.
Correct. That is correct.
Wonderful. Kim, we've talked a lot about training and stuff. Tell us about some of the employee health and wellness initiatives that we've had going on.
Sure. The team, the Wellness Committee, has been extremely busy this year, done an excellent job of engaging staff in several different activities. We've had walking challenges. We are embarking on a financial wellness challenge, and drinking properly, not consuming all that sugar. And I think one of the most important programs or portions of this wellness program have been the mammogram bus.
Yes.
And ladies, if you haven't done so, we've got 2 or 3 more opportunities.
I think we have 3 more opportunities,
for the rest of the year. Please schedule yourself for the mammogram bus. We have about 120 females that are eligible for the free mammogram. About 35 or 40 have taken advantage of it, so we're probably at the 30-35%. So exciting, and it's really important. You can't take care of yourself, you can't take care of your family unless you take care of yourself.
I agree, and I think that so often we in healthcare forget to take care of us, right? We say we're too busy, we can't find time, and that's why we brought the mammogram bus to our employees, and that was one of my initiatives that we had been talking about for several years. So,
and I know that they're not done for the year. Look for another exciting challenge during the holiday seasons to keep us fit as we go through turkey and turkey season, and lots of sweets that are going to be tempting us. So look for another challenge here shortly.
And I think they're doing the financial wellness in November, and so that's important as we end the year and get into the spending times and set our goals for next year. It's not just about health, it's about financial wellness as well. And so we're partnering with Regions Bank to bring that to our employees, so I'm excited about those. So excellent. Well, Dr. Thagel, you know that it would not be a town hall meeting if we didn't talk about how great this team is doing with quality. So where do we think we're going to end the year up? You're at?
Absolutely. So currently we are meeting or exceeding our goal in about 6 of our measures. And of course, that's not good enough. Our goal is to meet or exceed our goal in every one of our measures. And why is that so important? Because we know that that is the impact on our patients' health that we want to have. That being said, we are doing a phenomenal job in really meeting measures and getting things done. We are so close to meeting our goal on some of our key measures, which includes PAPS, right? We're at 78%. Our goal is 80%. For the next 2 months, so through November and December, we have a wonderful opportunity to really catch up and get those PAPs done. We have some incentive programs that are on the way for staff, and I've done some polls with quite a few of the staff, really looking at what's that prize that they're really looking for and how do we get there. And so right now is put your foot on the gas and keep pressing. Don't let anyone leave with an open care gap, because really getting those closed for the end of the year will make the difference and get us those couple of percentage points that we need to get for a lot of the measures that we're working very hard on.
You know, I think it's great because we were recognized as being in the top 10% for quality of care, and I think it's only because of our laser-like focus that we have. My comment is always that we are only here to make our communities healthier, right? And if we're not making an impact, we're not doing our job. And so I do really appreciate all the clinical team, the front office, the maintenance, everybody in this organization has a piece of making that impact and making our patients healthier. And so that's really important.
Yeah, we are a team.
Yeah.
And so only with the help of the weakest link of the team, which is no one, is that we succeed. And so really just continue to be supportive of the provider, supportive of the MA, supportive of the front office, the contact center. How do we best serve our patients and how do we get these things done? And I think we do a great job at it. We just need to kind of keep going and really press for the next couple of months.
Yeah, I really don't want to lose focus at the end of the year. Let's go out with a bang,
That's
so
right.
to speak. That's correct. Kim, we've done a lot in our clinical thing, but we've done some IT stuff as well. And so I know that your directors of business operations and your operational team have been working hard to get us technology advanced on our registration side. We've had our last go live at Johnny Ruth Clark. How are we doing with GetWell?
Doing excellent with the GetWell. Like Elodie said, we've had every center has gone live with GetWell, and the initial response from the patients has been extremely positive. And I'm really happy to say I've met with several staff members, and they're really excited. I think it was a very nervous process. Yeah. It's always nervous. We're always nervous when we roll something out that's new. However, I think everybody's done a really good job, and we've had maybe 2 written complaints about they don't like the iPads. So overall, very, very well received. Average time is about 6 to 7 minutes to complete for a new patient even. Wonderful. So I think the data is showing it's going to do exactly what we want it to do.
Listen, I'm going to tell you a personal story because my husband is not very technologically savvy, let's just be honest, right? He doesn't even know how to use his phone most of the times. And so he came into one of our centers and he had to use the iPad. And so I called him after his visit. I said, how'd it go? He said, amazingly well. He said it was very easy to use. The staff knew what they were doing. And so I figured if he can use it, anybody can use it. It was really positive.
Yeah, and I think the efficiency with getting patients in, right, really helps with clinical workflow, getting patients through. Patients are satisfied, we're happy, and then we'll remember to continue to push the portal.
That's correct.
Which is the second arm of our IT technology, which again helps with clinical workflow and creates a lot of patient satisfaction because they do get a chance to really kind of delve into that.
Absolutely. So I'm really proud of all the work that we've done to create healthier communities, but we have so much more to do, and we are entering into a major growth phase of our organizational life cycle. We've outgrown our facilities, right? We have no more exam rooms left. Once we hire these last few positions or bring in more NOVA faculty members, we'll have outgrown every single one of our facilities. And so our board of directors and our leadership team has really been looking at this over the last several years and has supported us in a strategic plan to increase our footprint in Pinellas County. And either that would be by increasing services at current location or expansion of services services. And so many of you have probably heard that we bought a new facility out in Highpoint. That will begin phase 1 of our growth plan. And so we've bought this new facility, and our administrative team has transitioned, some of our administrative team has transitioned over to the Highpoint facility. And it's been a little bit chaotic, I would say, right?
It's a bit chaotic and a little bit crowded. We thought we were moving into a lot of space, but we know it's temporary.
That's right. It's temporary. But I think
But
that we
it's
also can put ourselves in others' shoes now, right? When they say they don't have a lot of space.
Sure.
And being mindful that change is hard on all of our staff members. And so I think that makes us take a second step and thought process when we're making change in some of the centers. So I'm excited. But anyways, as I've said, that's phase 1. We've moved 28 employees over there. We also will begin a new pharmacy at our Pinellas Park location as of January 2nd. I hope. We're almost there. They're putting up the shelving I saw today. And so that will help our patients become compliant with their medications.
Absolutely. I mean, I think that increases access, right? Our patients have difficulty getting to places. And so when they come to see us, the more services we have available, the more likely they will be compliant with getting them done. And so I'm very excited for that pharmacy there. We have our weekend hours currently at Pinellas Park. And so our patients will have immediate access to access their medicines there. So that's great.
One of the most exciting things in phase 1 is we actually will be building out our Lealman facility. We'll be adding 4 dental operatories at our Lealman location, a medical exam room, and our first medical prescription food bank in partnership with Feeding Tampa Bay. This will be the first of its kind in the state of Florida, whereby our physicians will be able to work with nutritionists and the food bank itself to write medical prescriptions for prepared foods for our chronic disease patients.
And I think that this is an absolutely innovative idea. It's not something that you hear about. We know food pantries and food banks, but this is a prescription food bank or food pantry where we'll be able to tailor the foods that our patients get to their conditions and to their disease states. And so by sending a prescription to the food bank, they're able to get foods. And we know that nutrition is the key. Right. Nutrition is the key for wellness. And so helping patients, modeling for patients what a healthy meal looks like, I think will make a huge impact. I think it would do it for me. I think it will do it for our patients as well.
Well, I'm excited about that new partnership with Feeding Tampa Bay, but USF will also be out there really kind of doing a longitudinal study on the impact of how that affects our chronic disease management and the compliance rates for that and whether or not we're able to replicate that throughout the county. So very exciting stuff. Phase 2 starts in the first quarter of 2020. That will begin the renovation of the new Highpoint facility, to which we will add a medical site there with 21 exam rooms, 7 dental operatories, and a 14,000 square foot administration building that will get us all back into one spot. So we've been kind of all over the county recently, so that's exciting. Construction is supposed to be completed by the end of 2020 for opening of that facility, so that's exciting. In addition to that, phase 2, Tarpon Springs Dental Center will be being constructed beginning in February. And so that's going to bring 10 dental operatories and 3 medical exam rooms out to our Tarpon Springs location. Actually, it'll be a standalone building next to our Tarpon Springs Medical Center. So I know that the physicians out there are excited as well.
Oh my God. I think that dental care is one of the things in Pinellas County that we lack most.
Correct.
And we see kids every day who've never gone to a dentist, and we see young adults who've never gone to a dentist, and that's just unfathomable, right? It's just hard to believe. But bringing that dental center there, partnering it there with our medical team, I think is going to make the difference in our northern part of the county. Providing that access, that again, access is just the key to getting people healthy. And so I'm very excited for it.
Further integration of our services together.
Absolutely.
And then phase 3, of course, will be culminating with the renovation of the current administration space over at Johnny Ruth Clark, adding more medical exam rooms as well as dental operatories. And so at the culmination of this growth phase that will probably subside at the beginning of 2021, we'll have increased our footprint by 36 medical exam rooms and 26 dental operatories. So, almost a third, 30% more than what we have now. So it's super exciting and will allow us to provide care to that many more patients. So. Kim, we've talked a lot about our clinical operations and about the growth of the facilities, but we are nothing without our people. Tell me what the People Pillar has been doing.
This year, the People Pillar, the main charge was to create a reward and recognition program. We heard from the staff very loud and clear that they really wanted us to reinstitute a robust program. The reward and recognition program is designed in 2 phases. Phase 1 is actually the tenure service awards piece, which we have kicked off. September 29th, we had our very first reward and recognition breakfast. We had about 32 staff that were celebrating years 5, 10, 15, 20, and 25 this year. So
And they were dressed to the nines. They looked great. Yeah.
And it was wonderful. During that breakfast, we had them come in, had a breakfast, got their pins.
Yes.
We had some of the staff, senior staff there pinning them. They actually got to spend time, and we recognized them by their supervisors giving us some feedback on what they've done in the time they've been with us and the value they add to the organization. We will do that every year in some form, have an annual breakfast, lunch, dinner, something to recognize all of those folks. We also want to include the folks that are celebrating their very first year. It's a tough year. You're learning a lot of new things. We're throwing a lot of things at them. And it's important that we recognize our first year anniversary folks. So they're getting a pin as well. They've all gotten them for this year, along with a padfolio that has a special star on it. So we recognize that we had to start somewhere, and some folks didn't get recognized because we haven't done this in several years.
Yeah.
So we want to let everyone know that you will be getting a pin. I think it's important. We all think it's important for them to get a pin to recognize their years of service. So look for that coming from your People Pillar team member or some senior leaders out there bringing you your pins by the end of the year. Phase 2 of the program is our reward and recognition called the All-Star program, and it's an on-the-spot program. What will happen with this is you'll see in the centers in the next couple of weeks a board going up. This is All-Star board. You'll see a nomination form and an opportunity for you to be recognized by peers, board members, senior leaders, patients. Anybody can nominate someone for an All-Star award. Once that reward is received by your supervisor and validated, you're going to go into a drawing every quarter. During that quarter, we will gather all of those nominations. Anybody who is nominated will get a special badge holder that has our new logo for our program on there. And you'll go into a drawing each quarter for a prize that's valued at $250. So we're really excited. We hope folks will really take advantage of that and support one another in recognizing all the good things that we do day in and day out. So we're really excited. We'll kick it off the end of the year and really have a robust welcome to the program. End of the year, kick it off for January, and look forward to some really good reward and recognition coming in.
Well, I want to thank you, Kim, for your leadership on that and all of the People Pillar, because I know it's been a whole year of dedication and commitment to make sure that we did this right for our employees. So thank you.
It's been a pleasure. It's very very rewarding to work on a program that rewards our staff that deserve that recognition.
And I'll chime in to say that, needless to say, like we've already said, without our people, without our employees, without you, we are not. And so really helping you to know how appreciated you are, how much you're valued in this organization. I think taking time out to do that certainly makes a difference, because you are.
Well, we're about out of time here, but I did want to say that, as everyone knows, the holiday time is right around the corner, and as is our normal tradition, we at CHCP will be giving our staff members the gift of time on December 13th. It seems to be very popular with our staff members. So we will be closing a half day on Friday, December 13th. Everyone will still be paid, and you get time to yourself to go enjoy the holidays, to get yourself prepared for the chaos, to just take a breath, do whatever it is that you would like to with your time. We also will be sponsoring some families from the Lealman Dream Center. Some information will be coming out on that if you'd like to participate, to give back to those in need in our community, as well as some volunteer opportunities if you so choose to. In 2020, CHCP will be celebrating 40 years of service. It's grown and prospered for 4 decades on strong leadership from our board of directors, exceptional clinicians, staff, and the unwavering support of our community. I look forward to our continuing success with all of you by my side. If I don't get to see you this holiday season, I hope all of you have a beautiful holiday season and a very happy new year. Thank you.